Remke with Economic Thinking. This is part three of a presentation given to the Summer University held this year in July at Aix-Marseille University in France. So I ended the second session discussing conflicting or disagreeing theories of what causes obesity, which of course is correlated with type 2 diabetes, prediabetes, cardiovascular disease, and other chronic health conditions. The mainstream view has long been that it's an energy balance issue, calories in, calories out. So if people want to lose weight, they need to eat less and exercise more. And that's the advice they're often given by their doctors and nutritionists. The alternate theory says that weight gain comes from a problem with metabolizing energy in the body, that many of us are not able to metabolize carbohydrates effectively and keep stable blood glucose levels. So they're claiming it's a carbohydrate insulin model that we should focus on. And our food should be such that it gives us stable blood glucose levels. When we eat too many carbohydrates, that leads to excess carbohydrates being pushed into the fat cells with insulin and later leads to insulin resistance. So that is a discussion and debated, and I discussed it in the last session. You can read this article and other articles to get a better idea of what these claims are. So there are theoretical discussions on it and practical as people run these studies of trying low carb diets versus low fat diets, which one is most effective, which one is easiest for people to stick to and regain their metabolic health, actually reversing or putting into remission type 2 diabetes. So I often refer to these as two distant metabolic gifts. That is, in ancient times and actually all times before the Industrial Revolution, there were famines. It was often difficult for very poor people in agriculture to get through the winter. If there was a late spring or heavy rains or weather problems, people needed to put on fat in order to survive times when there wasn't ready food. So our body naturally eats as much as it can of carbohydrates, nuts, grains, fruit that's available in the fall each year, and we rapidly have weight gain, and that weight is drawn off during the winter. So it's a metabolic gift that we can gain weight rapidly. And it's another metabolic gift that we can fast, that we can go hours, days, weeks without eating at all as our metabolism switches to metabolize the stored fat, turning that into fatty acids, acetone, beta hydroxybutyrate, uh, and another that we burn and actually burn more effectively. We have more energy, our brain is better in many ways. So, this is a natural process to switch back and forth between gaining weight if we eat excess carbohydrates as are available in the fall for thousands of years and dealing with not having any food, switching to fasting. Richard Feynman, in one of the most compelling books, overviews on the nutrition topic, uh, focuses on flawed studies, misleading advice, and the real science of human metabolism. He has a rule two: if you want to lose weight, don't eat. But if you have to eat, don't eat carbs. Rule three, for diabetes or metabolic syndrome, try carbohydrate restriction. That's the default approach. It's not risky. Try that first. But current federal health policy says it is risky. In fact, the federal government will recommend bariatric surgery and various drugs for overweight children before they recommend nutritional approaches, that is, reducing carbohydrates. In fact, for people who put children on a ketogenic low carb diet, healthy fat, low carb diet, they're saying you need 6 blood draws a year to make sure everyone's healthy. Well, that's, critics would say, flawed advice. So today's metabolic problems, these researchers argue, helped our ancestors add weight fast in October to survive winter. The second metabolic gift, our ancestors were fit, energized during famines. And now in grocery stores, though, the challenge is it's always October. So it's easy to gain weight when fruit's always available, nuts and grains always available. More on this, the book Eat, Fast, Feast by Jay Richards, A Christian Guide to Metabolic Health, is recommended. You can get scales that'll measure your body fat as well as your weight and other factors so you can track how you're doing. Um, and then the book Eat Fast, Big Fat Surprise by Nina Teicholz here. And I write about those on my Normal Nutrition Substack page. And I talk about my own history, two surprise nutritional journeys where I rather unexpectedly, after watching Nina Teicholz at Keto, just stopped eating sugar, sweets, cookies, and most carbs, stopped eating breakfast cereal, had bacon and eggs, cream, meat, cheese, fish, and lost 20 pounds over a month and another 20 pounds over the next 6 months. And that was almost 20% of my body weight. And I've kept that off the last 4 years, not through iron willpower or anything like that, just by trying to stay away from bread, pasta, carbs that hurt me because I'm, for whatever reason, pre-diabetic and have had trouble handling high carbohydrate foods and sugars. So this isn't a new thing. There's a long history of advice for those that are overweight. The Atkins diet that is often derided as being a fad, Gary Taubes writes that this wasn't new. Herman Thaler, whose 1961 book, Calories Don't Count, sold 2 million copies. Thaler learned his diet advice from Alfred Pennington, who used to work with DuPont and slim down their executives, just advising them to eat less starches. And then one of the founders of the American Heart Disease would prescribe it to patients, 20,000 of them over 40 years. The Banting diet was recommended in the 1800s. The story of Banting, who his doctor, when he couldn't lose weight, his doctor said, stop eating starches. He did. He lost weight. He wrote a pamphlet that was reprinted many times. And these ideas came from France and went to Germany, but somehow all this knowledge was lost as the American push toward low-fat diets came, as discussed earlier, from Ancel Keys and other advocates of the federal dietary guidelines. So this is a big deal. Only 12% of Americans now are metabolically healthy, according to a study from the University of North Carolina. World Health Organization says there's some 60 million people with diabetes in the European region, aged 25 years or over, and pre-diabetes at 32%. So problems in America and Europe, Asia, and so forth. And a key part of this is when you look at the official institutions, Diabetes UK is still recommending standard, whole foods diet and not really recommending reducing carbs directly. The separate organization, diabetes.co.uk, here featuring the well-regarded Dr. David Unwin. Some 80% of his clients in his general practice in the UK have put their type 2 diabetes into remission simply by changing their diet. And his office has gradually reduced their drugs and people get healthy. It's amazing. Yet the American Diabetes Association, here in this much ridiculed video, has the education director telling people that they can eat plenty of carbs, just be careful. And they have this diabetes plate. The secret to starting is following this, according to her. Nina Teicholz is critical, as are others, calling it the American Get Diabetes Association. Because if you have type 2 diabetes, restricting carbohydrates dramatically is the key, at least has been successful in health clinics across the country. And so, why is the federal government, current federal healthcare policy, opposing this, both with the federal dietary guidelines and the American Diabetes Association? And so, that's what I recommend students look at in reforming healthcare policy in the US. And I think I'll stop here for now and then continue in the next session. And then Terence Keeley's book, Breakfast is a Dangerous Meal.